Good afternoon, everyone. It's my privilege to speak today on this panel and share Georgian experience for COVID-19 response. Georgia is a small country with 3.7 million population, and up until now, we've managed to contain the spread of the epidemic. And as of today, we have 735 cases reported, and with 547 recoveries and 12 deaths. As compared to other countries in the region, this is quite low, and Georgia appears like a green island in the region. And this was possible via very strict social distancing measures. The government decided to introduce restrictive measures as early as in February, because we've decided it's better now to go more proactive and prevent the spread of the epidemic rather than deal with increasing number of cases, which would be very difficult to manage without having effective drugs or knowing how to deal with such a high level of uncertainty. Georgia established a multi-sectoral committee because it was very clear from the very beginning that health sector alone could not handle this, and we had to be engaged all sectors, including Ministry of Interior, Ministry of External Affairs, and all other agencies, which really played a huge role in providing different interventions or in supporting different interventions and making the response truly multi-sectoral and really comprehensive. As for the healthcare side, of course, our major purpose was to make sure that healthcare facilities are well prepared and equipped to respond to COVID cases. Of course, the first major objective was to make sure that we have adequate testing capacity. And thanks to US government support, we have a well-functional Lugar Center in Georgia, which has a very good biosafety technologies in place. And Lugar Center was able to quickly introduce PCR testing technologies for COVID-19. And since early February, we could do testing for all incoming travelers who were found with fever at an entry point. Since then, we've rapidly scaled up testing capacity, and nowadays we have around 12 private labs engaged with testing, and our testing capacity daily it's up to 1,500 tests, and we intend to increase the testing capacity, almost double testing capacity by the end of June. Up until now, we've tested over 50,000 individuals with less than 2% positivity rate. Testing strategies were really well elaborated and targeted to high-risk individuals. And right now, we continue mandatory testing for healthcare workers, as well as people in quarantine, because we still have 14 days mandatory quarantine for all incoming travelers, regardless of the country of origin. No matter is it a foreign citizen or Georgian citizen, everyone coming to the country, they should undergo 2 weeks quarantine, and then we test them at 13th day. It's very important to have healthcare facilities well prepared, and we do appreciate assistance provided by USCDC, World Health Organization, and other international partners in training epidemiologists. And our epidemiologists, they had field epidemiologist training program far before the COVID epidemic, so they were well prepared for field activities, and it was very helpful to have them on board immediately with the COVID response. As for the health facilities, of course, the government decided to cover all costs related to COVID, was that testing or inpatient care, and hospitals were mobilized, and we now have 29 designated COVID hospitals and then 15 fever centers at each district level to make sure that we avoid nosocomial transmission of disease. And we have a more active control of patients' flow. The good news is that those hospitals are now empty, and we only have 12%, less than 12% of utilization rate for those hospitals. They are kind of in a standby regimen, and if we need them, we can activate those hospitals really easily. On May 22nd, the government canceled the state of emergency, and now we are lifting all restrictions that were in place, and the post-crisis plan actually defined a very specific interventions and steps how to lift and what should be timeline for lifting restrictions without going back or getting another wave of the epidemic. Nowadays, our major challenge is again to establish safe procedures for incoming travelers. And you may know that Georgia is a was a very attractive touristic destination before COVID. And of course, we want to again reactivate like touristic activities in the country. And now we are discussing what would be the best and most appropriate measures for letting people in safely without bringing like risk to the community. Of course, there is communication to the public, and public engagement was our major objective. And I think it's really important that people now understand COVID-related risks, and they started to adopt protective behaviors, which is very important in the long run, and we will continue working on that. I would stop here. Yes, I would stop here, and I would like to mention that we can't wait for establishing the CDC local office, the CDC regional office in Georgia, and we are really honored to have this opportunity. And of course, Ministry looks forward to this cooperation within the country and in the region. Thank you.
Thank you.